Welcome back to my channel. Just like we did implementation, it's the same thing we're going to do with assessment. We are going to add all the three implementation in one place, because when you look at the marking criteria, it's almost similar in all the three stations. And remember the evaluation is the last stage of the APIE, and it takes only 8 minutes, so you should be fast. So I don't want to take a lot of your time, so if you're a new subscriber, please if you're new person viewing this channel, please subscribe, comment and ask questions where you want clarity. And also, if you're a return subscriber, thank you for watching. Thank you for keeping glued here. I'm here to serve you. Please let me know of videos you want to watch, so I can see if I can make videos of them. Okay, so we are going to dive right into what we're going to do. So we have the evaluation. The evaluation has only 7 marking criteria, so we're going to go through the antenatal evaluation marking criteria, go through the labor evaluation marking criteria, and also go through the postnatal evaluation marking criteria of the APIE. Then after that, we shall go through the how do we answer implementation when you're doing it then on a patient, because it's the examiner that has the assessment criteria for you. Your work is to do the practical part. Okay, so how do we go about it? We're going to go through that. Okay, so let's start. I'm going to start with the antenatal evaluation marking criteria. I'm going to read for you from 1A to 7. So we're going to go to 1A. States the name of the woman, hospital number, and the date of birth. Okay. 1B states the reason for the handover. 2A states the date of admission, visit, reason for initial admission or referral to hospital, and to the referral to a specialist team and diagnosis. Actually, what I see for those who did OET, that referral letter is something similar to this, to the evaluation. I don't know if someone has seen something that has noticed that is somehow similar. If you look back to how we write the discharge letter or referral letter of the OET, it is similar to the evaluation. How is it? So we go on to 2B, which says notes relevant previous medical history, obstetric history, and relevant allergies, medication, and social history. 2C outlines findings provided from the most recent assessment. 3A outlines current events, findings from the most recent assessment. 3B outlines all care and medical interventions that are completed. 4 uses SBAR tool to hand over information verbally to the examiner. States what is required of the person taking the handover and proposes a realistic plan of action. 6 verbal communication is clear and appropriate, acts through in accordance with the values and requirements of the NMC 2018, the Code of Professional Standards and Practice Behavior for Nurses and Midwives, Nursing Associates. So what does this mean? If you've gone through the planning video, you can notice that we used SBAR to write the planning videos. Okay, so even it's the same thing with evaluation. So generally, the assessment is practical. The planning uses SBAR and the implementation uses SBAR. The implementation is also practical because you have to talk. Okay, so I want you to just put it in mind that planning and evaluation use SBAR tool Okay, just have that in mind. So whenever you're writing, make sure you have that in mind. So let's go on. We are done with the antenatal evaluation marking criteria. So we shall go on to the labor and birth evaluation marking criteria. Okay, so still we go. 1A states the woman's name, hospital number, and date of birth. 1B states the reason for the handover. 2A states the date of admission, visit, reason for initial admission or referral to the specialist team, and diagnosis. Then we go on notes previous medical history, obstetric history, and relevant medication, social history. 2C outlines recent events and details the findings provided. So outlines the recent events, details findings from the most recent assessment. Then 3A outlines care and medical interventions completed. 3B states reasons, states areas of concern for maternal well-being. 4 uses SBA tool to hand over information verbally to the examiner. States what is required of the person taking the handover and proposes a realistic plan of action. Verbal communication is clear and appropriate. 7 acts throughout in accordance to the values and requirements of the NMC 2018, the code, professional standards of practice and behavior for nurses, midwives, and nursing assistants. Labor evaluation is done too. Let's look at that. Postnatal evaluation. I'm reading them all so you can see the similarities that we have. So you put it at the back of your mind that this is similar, but what goes to which specific something, okay? So we shall go on with the postnatal evaluation, and 1A states the woman's name, hospital number, date of birth, and discharge address. Have you noticed that? Under evaluation in postnatal, you should also put the discharge address, where the woman lives, or where she's going to live after discharge, because when you arrange transport, that's where they will take her. Okay. States the reason for the handover, states the woman's name, hospital number, date of birth, and the discharge address. So this is repeated twice. Okay, I don't know if they want it twice, I'm not sure about that, but it's repeated twice. In this scenario, it is 1A and again it's 2A. Okay, so states the reason for the handover. This again is repeated. Outlines recent events and details from the assessment. So recent, you should name it in the background, and then the findings still, and the postnatal check about the mother and the baby. Then outlines care and medical interventions completed. From your plan, what were you able to accomplish? What did you tick off? Okay. Then states the reason of concern for maternal well-being. Uses SBA tool to hand information over verbally to the examiner. States what is okay. We've been on number 4. Uses SBA tool to hand over information verbally to the examiner. 5 states what is required of the person taking handover and proposes a realistic plan of action. For example, like blood pressure every hour, take off more blood for examination in the lab, and then the urine we check for C protein, C reactive protein, and then 6 we have verbal communication is clear and appropriate. Then we have acts throughout in accordance with the values and requirements of the NMC 2018, the code, the professional standards of practice and behavior for nurses, midwives, and nursing associates. Hello, are we together? So I'm done with reading the evaluation, so we're going to go into the how. The how is not so different from from what we did in the planning, but just a little more that this is like your handover. So we shall go on to I will remind you that this is a 15-minute evaluation. Is an 8-minute session. It's not 15, sorry. So you'll be given all the information starting from your assessment, your planning, and your implementation. So your evaluation should be based on that. Don't write anything that you didn't do in the previous sessions and write it here. Okay? So this is a silent. You'll be also given a different pen, and they'll tell you to assume maybe it's 2 days later to enable you discharge or transfer the patient like after birth. That is what she says. So they're looking at you being able to discharge the patient and writing the transfer later. Okay, so remember to write your name, signature, and date at the back of the paper. Okay, so then you begin. My name is Sarah. I'm going to be your midwife. I'm the ward midwife or triage midwife according to where you are. The midwife in the labor ward, depending on where you are, or in postnatal. Okay, the date and time 24th July 1991. Okay, at 4 p.m. Don't mind about that date. I used the years of muscle back, but that's what we want to see. That just to make sure you write the date there, and that's it. So then re is the patient. Re is patient. Let's continue. The name I've been using. Re is patient Jamila Nasuna. Date of birth 12 of Jan 1994. Dear hospital number 123456, and dear midwife, GP or community midwife, according to where you're referring the mother. So you may be referring her to another midwife, you may be referring the mother to the GP, you may be referring the mother to the community midwife. Okay, so you address accordingly to where the letter is going. Okay, so in the situation, so we're beginning our SBA, okay, after writing the re where it's going. So now we begin the situation. I am writing in regarding to patient Jamila. She's a gravida 3, para 2 plus 0 with 28 gestational age, who presented or was admitted to the hospital, the ward due to having severe lap and intermittent bleeding. She was diagnosed with what should I call it? The word is lost. It has grown wings. Okay, who was diagnosed? Okay, let's say who was diagnosed with a non-competent cervix. Okay. Or was diagnosed with UTI, or she was diagnosed with, who presented with a vaginal discharge on such and such a day. Okay, so then you go on back to the background, then you state on such and such a day. The background you also do, before you state the such and such a day, you go on to do the social and family history. Whom does she stay with? Family history. Do they have those chronic illnesses? Hypertension, diabetes, those are mostly in the family history. The sickle cells. Then you go on to do the medical and allergy history. Okay, remember to ask the mother, remember to ask, you write what you wrote. The mother has no allergy or has an allergy. Then you go on to the obstetric history. You have to include all the assessment and implementation and planning. Okay, then you go on and do the assessment of the mother and baby. You say you visit the scenario again and read the instructions on it and say the doctor reviewed patient Jamila who has a normal CTG and was diagnosed with, so that will be from your evaluation. Yeah, from your evaluation scenario, so you get that. And then you say today the result of my assessment were like below. So you note your observations. Remember we said we have 6 observations, and that's the temperature, pulse, blood pressure, oxygen saturation, respirations, capillary refill. Doctor reviewed prescribed antibiotics, Moxclav, Moxclav, and the current vital signs. So that's done. Then in terms of psychological assessment, postnatal scenario, you will say the mother is breastfeeding, and we talked about her diet and sleep, like what you advised her. She's sleeping well or not? Is she able to eat or not? Okay, you have to explain to that. And the stitches and look here, baby seen passing poos and urine about the nappy and feeding bottles. So you write about what you found at the woman's home. Was she able to was the lady able to pass, was the baby able to pass urine and all that? Whatever you examined, the result is what you write. The baby is alert, no jaundice, then you go on to write the recommendations. So it may be a referral or a discharge letter. So due to my findings, I appreciate it if you could or my further recommendations be as below. So for the recommendations, remember the midwifery support and reassurance. Then we go on to continue to educate, to continue the mother, to continue paracetamol and antibiotics as prescribed. Educate on hand express, on how to express feed the hands if the baby is not breastfeeding to avoid breast engorgement. Educate or inform the breastfeeding team about the mother having difficulty in breastfeeding. So you have if the mother is going to the community, you have to make sure the mother has been transferred to the community midwife, and then the patient medication has been given. The patient will need to visit the clinic if she has any concerns. Okay. So what can you educate the mother about? So educate to have a healthy and balanced diet, educate to be hydrated to avoid UTI occurrence, ensure the mother changes pads frequently. Okay, educate to attend to triage if any unusual findings are seen. Educate family members to prepare feeds for her. Give her my number. Ask to do a 50-day postnatal check on the 10th day postnatal check. Give her my number to contact whenever needed. Educate about warning signs such as vaginal bleeding, decreased fetal movement, and pain in the lower abdomen. Educate to move or early mobilization to prevent deep venous thrombosis. Attend antenatal clinic due to midwifery routines. Okay. Educate to set the next appointment and partner support. Thank you so much for watching. Do you have any questions? Please leave them in the comment section. Have you subscribed yet? Please subscribe. I'm going to be posting more content about the same. Okay. What else? So we are now going to start the linked stations. I think we should start with the NIPE. So our coming stations will be about the NIPE. We're going to do NIPE according to the NICE guidelines, and stay tuned. Are you excited like I am? Tell me about more content you really want to watch, and now please subscribe and comment. Share, recommend the videos to others, recommend the videos to your friends, your family, to yourself, and to anyone who may need it. Thank you so much. Thank you for sharing. I love you all. May God bless you all.